Today we're going to look at how to do 6 anterior crown preps that is efficient. I realise that some of you don't like crowns, but this is not really about whether a crown is appropriate, it's learning the skill for when it's necessary. Prepping really fast is actually important. It's important for patient comfort, it's important for health of teeth. It's also important so that it gives you more time and more mental energy to focus on things like tissue retraction, cord, impressions, scans, temporary. So if you are less fatigued at the end of the preps, you have more mental energy available for everything else. So let's assume that we've already got a mock-up here. These teeth had a mock-up and this is the final shape that we want them to be. So you'll notice that first up, we don't do depth cuts. So choose a burr that's the right diameter and then just cut that much off the top of the tooth. So in this particular case, we want to do 1.5 millimeters of, or 1.8 millimeters of reduction. So we've just taken that straight off. Then I've used a burr, because I'm going to prep all 6 of these teeth for whatever reason, for practice actually. We then go and open up the contacts. It just makes it a lot easier when you're going around the tooth so that you can see what you're prepping to. Now, obviously you don't open up the contacts if you're not doing crowns. Then you can see here, I'm going straight through and we're doing a secondary plane of reduction. We know that we need to do it, so we might as well do it now. Once we've done those cuts, then we can go back to starting the axial reduction. Now, in this case, we don't need to do depth cuts either. We're doing a crown. We know that we need to have a margin of a certain thickness. So let's say we've decided we want a margin of 0.6 millimeters. All we need to do is get a burr and cut a 0.6 millimeter margin and have the correct path of insertion, and then the crown prep is largely done. And if you do that, you don't really need to do depth cuts, particularly for crown. For a veneer, it's different because veneers are much thinner. So you can see here, I'm just going around at this point and I'm prepping. Now this video is sped up, so it will look like I'm prepping faster than I actually do. But what I'm doing here is I'm just trying to prep mostly in one attempt. So you'll notice that my first prep is almost to the correct position straight up front. So you watch this lateral incisor here. So we get the burr into the sort of depth of margin that we want, and we pretty much just go around there like so. So, and then we prep, say, a canine. Now, canines are really important because mostly dentists prep them flaring out towards their ears, and then it makes it very difficult for the technician to make the canine crown look right, and it ends up with a weird bulge in the middle. So with a canine, most of the time, unless the pulp is in the way, you want the prep fairly parallel with the anteriors. The other thing that happens is if you don't get all your preps parallel, then your temporaries don't fit, and they tend to break or get stuck, and your impressions or your scans are quite difficult. So here you want to, Now, you can also see it's the same when I do the lingual. I'm trying to do it now. I am doing this with a mirror, so I can kind of go all the way around that lingual side in one go. Now you can see here that the distal of the canines, I'm using an extra fine burr just to open that contact first so I can see what I'm doing. Obviously, if you're prepping 10 teeth, then it doesn't really matter so much, but if you're not, then you really want to open that up first, and you can see where to go with a normal burr. Now, sometimes on the distal of teeth, you need to use a thinner burr to prep that margin. Now, I'm getting the margin on the canines pretty much sort of nice and smooth all the way around. Now I'm doing the lingual reduction, so I've done the margin on the lingual and then it's more the cingulum area. Now I just use a 1.8 millimeter burr to do this. A football is probably easier if you have a football burr available, but I tend to try and keep my burr set up to the minimum because it's more efficient. It also forces you to have the discipline to focus more on one step at a time. So here, I'm just going back and refining that secondary plane of reduction. and then refining some margins. Now, when you're refining margins, you really want to get the prep as perfect as you can with a coarse burr. The fine burr is for making the prep smooth. It's not for correcting it. When you try and correct preps with a smooth burr, what tends to happen is the burr doesn't cut very well, and then you push hard, and then you're actually more likely to put a dent in the prep. So make the prep smooth, like flowing and continuous with a coarse burr. So there's no like burr dents in it. The only thing that should be stopping it being smooth when you're finished is the coarse grit on the diamond. Now, the coarse grit on the diamond obviously leaves the surface of the tooth, scratchy, and you go back maybe and smooth that up. But you don't want the prep itself to be bumpy or incorrectly shaped, and you don't want to be trying to correct the incorrect shape with a fine burr. You're more likely to put dents in it. So it's like a lot of things in dentistry. If you don't get the first step correct, then all the other steps become more difficult. So take the time to get that first step, which is the shape of the prep, get it basically perfect with a coarse burr before you move to a fine burr. And you can see how much reduction there is. Like if you get the correct margin and the correct path of insertion, then you will have very adequate reduction. You don't need depth cuts because the amount of reduction is so significant. So right now I'm using a 014 super fine diamond burr on a red band handpiece, so it'll be running at 200,000 RPM, and I'm just trying to now make the surface of the tooth smooth rather than the shape correct. So the shape is all correct, and then if I saw a dent or a bump, then sometimes it's easy to get rid of it with a Softlex disc because the disc is quite wide and it's kind of flexible. So you can see here particular areas that are important is there's often a sharp ridge between the lingual of the prep and the mesial and distal, and there's often the incisal edge portion of the tooth is often kind of bumpy with a burr, so it's easy to get that flat with a disc. And just any areas where you got some little lumpiness from the burr, it's much faster to use a disc to get those lumps off. And then if you want to, you can polish. Now there's disagreement about this. Some people say your prep should be rough, it gives them more retention. I'm not sure that's true. I think on the microscopic scale that cement works at, that you don't need the roughness that's acquired by using a very coarse burr. Certainly, if you use a coarse burr, the impression and the scan will never, the crown will not be as accurate a fit. So you'll have more retention or surface roughness for the cement to get into, but you will have less, like there'll be a bigger volume of cement between the crown and the tooth because it's got to fit not only on the top of the scratches, but at the depths of the scratches. And so this will result in the restoration being less well-fitting. So that's how I do crown preps. So I just hope you enjoyed the efficiency of that. It is sped up a little bit, so don't be depressed if you can't actually do your 6 preps in 10 minutes. And obviously on a real patient, you would need to remove all of the cores and do the build-ups and so on. So, but what I can say is that principle of, do all your incisal reduction in a single cut, open your contacts, drive around the tooth. That's how pretty much everyone who's super experienced does it. Don't put vertical depth cuts on the face of your tooth because it's very hard to get rid of. And then you basically will find that often after a lot of polishing, you can still faintly see the bumps in the tooth right at the end of the prep. And there's no shame in being fast with prepping. Being slow doesn't mean you're better. So there's a lot of people who prep slow and they still do bad preps. Fast preps are important for allowing you to be fresh for all the more difficult parts of the procedure, which is the retraction cord, temporaries, and so on. So speed up the things you can because there's many things that you need time for that you can't speed up. Thank you very much. If you enjoyed this, please tell people about it. If you want to upskill, go to Right Global and check out the Fellowship in Restorative Dentistry.